Welcome to Healthy Secrets, your trusted source for clear, actionable health information. I'm glad you're here with us today. Before we dive in, do me a favor and hit that subscribe button right now. By subscribing, you ensure you never miss out on life-changing health tips that can empower you and your family. Today, we're tackling a topic that many of you have asked about, something that can feel both minor and deeply concerning all at once. We're going to unravel the mystery of those strange specks, squiggles, and flashes of light that sometimes appear in your vision. Have you ever been looking at a bright blue sky or a blank white wall and noticed tiny, translucent shapes drifting across your field of view? They can look like little cobwebs, spots, or even tangled threads that seem to have a life of their own. So, let's get right to the core of it. What exactly are eye floaters? Imagine tiny clumps of cells or protein fibers floating inside the gelatinous vitreous that fills most of your eyeball. The vitreous humor is normally crystal clear. These microscopic clumps drift through the vitreous and block light from reaching your retina, the light-sensitive layer at the back of the eye. A floater is actually the shadow that this clump casts on your retina. That's why they move as you move your eyes, and often drift slowly downwards when your eyes are still. Floaters come in many shapes and sizes: small black or gray dots, squiggly lines, rings, cobweb-like structures. Their appearance depends on size, shape, and distance from the retina. Closer to the retina, sharper, more defined shadow. Further away, fainter, more blurred. They're most noticeable against a uniform bright background: computer screen, white paper, clear sky. Now let's talk about flashes. Floaters are seeing shadows. Flashes are seeing light with no external source. People describe flashes as brief streaks of light, lightning bolt, camera flash, often in the peripheral vision. These photopsias aren't shadows. They're generated by physical stimulation of the retina. When something inside the eye pulls, tugs, or rubs against the retina, it triggers a signal your brain interprets as light. It's a mechanical action causing a neural response. Key point: floaters and flashes have different origins. Floaters, shadows from debris in the vitreous gel. Flashes, the retina being physically disturbed. Because the retina is critical for vision, signs of it being pulled or disturbed, like flashes, need faster attention. Stable, long-standing floaters are often benign. Sudden new flashes, especially with a shower of new floaters, should prompt a swift call to your eye care professional. To truly grasp why floaters and flashes happen, we need to take a simple tour of the eye's anatomy. Think of your eye as a hollow, spherical camera. The front part includes the cornea and the lens, which work together to focus light. The back inner surface is lined with the retina, which acts like the camera's film or digital sensor. It captures light and converts it into electrical signals. These signals are then sent to the brain via the optic nerve, allowing you to see. The central cavity between the lens and retina is filled with a clear, jelly-like substance called the vitreous humor. In youth, the vitreous is firm and gel-like, similar to set gelatin, and it completely fills the back of the eye. It's about 99% water, and the other 1% is collagen fibers, hyaluronic acid, and other proteins that give it structure. This transparent gel helps the eye keep its round shape and acts as a shock absorber for delicate internal structures. In a young, healthy eye, the vitreous is gently attached to the retina, especially around the optic nerve and at the retinal periphery, so things stay in place as you move your eyes. With age, a process called vitreous syneresis begins. The gel slowly liquefies and loses uniform consistency. Long collagen fibers that were evenly spread begin to clump together, forming aggregates or strands. These condensed fibers are denser and less transparent than the surrounding liquid. Those clumps and strands are the floaters we see, suspended in watery vitreous and drifting, casting shadows onto the retina. This aging change is the most common reason people notice floaters, usually after 40 or 50. But it's not only age, certain factors can speed this up. Very nearsighted, myopic eyes often change earlier because the elongated eyeball strains the vitreous. Also, people who've had eye surgery like cataract removal or significant eye trauma or eye inflammation may develop floaters prematurely as the vitreous structure is disturbed. The liquefaction of the vitreous often leads to a very common and usually harmless event called a posterior vitreous detachment, or PVD. As the vitreous gel shrinks and becomes more watery, it can no longer completely fill the space within the eye. Eventually, the gel will pull away from its gentle attachment points on the retina. Think of it like a jello mold, slowly shrinking and pulling away from the sides of the bowl. When the vitreous detaches from the back of the eye, This is a PVD. It's an extremely common part of aging, affecting over 75% of people over the age of 65. The onset of a PVD is often what causes a sudden increase in the number and prominence of floaters. A particularly large and noticeable floater, often described as a ring or cobweb, can appear. This is known as a Weiss ring. Many people also experience flashes of light during a PVD as the separating vitreous tugs on the retina, especially at points where the adhesion is stronger. In the vast majority of cases, a PVD is a benign event. The vitreous detaches cleanly from the retina without causing any damage. The floaters and flashes might be alarming at first, but they often settle down over a few weeks or months, and the brain learns to ignore the new floaters. However, in a small percentage of cases, the process doesn't go so smoothly. If the vitreous is attached too strongly to a particular spot on the retina, it might not just pull away cleanly. Instead of detaching, it can actually rip a small hole or tear in the retinal tissue as it pulls. A retinal tear can let fluid get underneath the retina, lifting it like wallpaper from a damp wall, a retinal detachment. This is why it is absolutely critical to see an eye doctor right away if you experience the warning signs: a sudden shower of many new floaters, new and persistent flashes of light, a dark curtain or shadow moving across your vision, or a sudden decrease in your peripheral, side vision. When you see an eye doctor for new floaters or flashes, their first priority is to perform a thorough dilated eye exam. They will use special eye drops to widen your pupils, which gives them a clear panoramic view of your entire retina and vitreous. This allows them to check for any retinal tears or signs of detachment. If the retina is healthy and intact and the diagnosis is a benign PVD, the most common recommendation is watchful waiting. For most people, the brain gradually adapts through neuroadaptation, tuning the floaters out so they become much less noticeable over time. However, for some individuals, floaters are so large, so dense or centrally located that they significantly impair vision and quality of life. That can make reading, driving, or working on a computer extremely difficult. In those cases, more active treatment might be considered. One option is YAG laser vitreolysis. An ophthalmologist uses a specialized laser to apply quick energy bursts to the floaters, aiming to break them into smaller pieces or vaporize them into gas bubbles. It's less invasive than surgery, but effectiveness varies. It tends to work best for single, distinct floaters and carries risks like increased eye pressure, damage to the lens, or damage to the retina. The most definitive treatment is vitrectomy. A surgeon makes tiny incisions and uses micro-instruments to remove the vitreous gel, removing the floaters with it. The vitreous is replaced with a sterile saline solution which is gradually replaced by your eye's own fluid. Vitrectomy is highly effective, but also a major invasive surgery. It carries significant risks including near-certain cataract, retinal tears or detachment, infection, and bleeding. For these reasons, it's typically a last resort. This range of options, doing nothing up to major surgery, has sparked debate in ophthalmology and among patients. Some specialists advocate earlier intervention with newer laser techniques and safer surgical techniques, arguing no one should suffer from vision-degrading floaters. Others are more conservative, noting neuroadaptation's high success rate and the serious risks of intervention. They say surgery risks often outweigh benefits for a usually benign condition. If you and your doctor have decided on a course of watchful waiting, it doesn't mean you are completely helpless. There are several practical, everyday strategies you can use to help you cope with floaters and make them less intrusive. One simple trick is to move your eyes. Look up, look down, look left, look right. Many people also find that wearing sunglasses helps. Polarized lenses can be especially useful in bright conditions. Sunglasses reduce brightness and glare, making floater shadows fainter and less distracting. Maintaining good overall health is crucial for your eyes. High blood pressure is a risk. Diabetes is a risk. Keep these under control with diet, exercise, and medication. There's no proven diet or supplement to eliminate existing floaters, but staying well hydrated helps. A diet rich in antioxidants may support vitreous and retinal health. Commit to regular comprehensive eye exams as your doctor recommends. This is especially vital if you are over 50, or if you have risk factors like high myopia. Ophthalmology is constantly evolving. Researchers are working on better solutions. Scientists are investigating pharmacological agents, vitreolytic drugs. These could be injected to dissolve the collagen clumps that form floaters. That would offer a non-surgical alternative. Advances in laser technology are also being explored. The goal is safer, more precise lasers that target floaters with minimal risk. These future treatments promise more effective, lower-risk options for people bothered by floaters. For now, the landscape is one of cautious optimism. Current interventions have limitations and risks, but ongoing research provides hope that within the next decade new therapies may change the standard of care. Progress could mean future generations won't have to choose between living with floaters and invasive surgery. The scientific community knows how floaters affect quality of life, and that understanding is driving innovation toward a simple, safe cure. As we've discussed, floaters can be a simple annoyance for one person and a debilitating condition for another. This wide spectrum of experiences is at the heart of the floater mystery. It's not just a medical issue, it's a quality of life issue. For someone whose livelihood depends on clear vision, like a pilot, like a surgeon, like a graphic designer, even a few prominent floaters can be a major professional obstacle. For others, the constant presence of these moving shadows can be a source of significant anxiety and mental distress, even if their visual acuity on a standard eye chart remains perfect. This is why the conversation around treatment is so nuanced and often personal. This is also where the debate gets interesting. Would you consider undergoing a procedure with known risks to get rid of something that is medically classified as benign? Some people feel their doctors are too dismissive of their symptoms, telling them to just learn to live with it without fully appreciating the daily impact. Others are terrified by the potential complications of laser. Others are terrified by the potential complications of surgery and would rather adapt than take the risk. We want to hear from you. Where do you stand on this issue? Would you opt for a procedure like a vitrectomy if your floaters were severe, or would you prefer to wait and hope for adaptation or future safer treatments? Your stories and perspectives are incredibly valuable. They help create a community of understanding and support for everyone navigating this condition. Sharing your experience, you've had floaters for years, you've recently developed them, or you've undergone treatment, can provide insight and comfort to others who are in the same boat. Please take a moment to leave your thoughts, questions, and personal stories in the comments section below. There are no right or wrong answers here, only shared experiences that can help us all learn from one another. We read your comments, and your feedback helps shape the content we create. Thank you so much for joining me at Healthy Secrets today, and for taking the time to understand this complex topic. I hope this discussion has brought you clarity and confidence. Remember, the most important step you can take is to have a dialogue with a qualified eye care professional about your specific symptoms. Be sure to hit that subscribe button so you don't miss our next video, where we'll be exploring another important health topic. We are grateful to have you as part of our community, and we look forward to seeing you again soon. Stay informed and stay healthy.